Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliament for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and those whose interests you have committed to our charge. Amen. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
We have a communication from the chair. Honorable members, I recognize 100 students of the debate club, English and Kiswahili, from Kahuho Secondary School in Elementaita Ward, Nakuru County, led by their teachers, Madam Frida Kinya, Mr. Sami Kenodia, Mr. Karanja. In our tradition of recognition and welcoming visitors to our county assembly, I take this opportunity to welcome you all to Nakuru County Assembly. Thank you. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
No petitions. Next order.
Order number 5, papers.
No papers. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
No statements. Next order.
Order number 8, motion.
We have a motion from Honorable Njuguna, Chairperson, Committee on Health Services.
Thank you, Mr. Speaker, sir. Mr. Speaker, sir, the Chairperson Health is held outside on another health issue, and I wish to take the committee or the House on this health report. And Mr. Speaker, since he's already in the House, I wish to ask his own indulgence that I go on and give out the report. Mr. Speaker.
Proceed.
Thank you very much. Mr. Speaker, the Committee on Health has had several meetings, and we have had time to visit different facilities within this country. And Mr. Speaker, there are some of the facilities that we have visited, and I'll give background information of Mathari National Teaching and Referral Hospital. This is a hospital that this committee has visited. Mathari National Teaching and Referral Hospital is the only public government institution, psychiatric hospital in Kenya. Mathari Hospital is a special national referral, training, and research public institution in mental health in Kenya. It is located along west of Nairobi, along Nairobi Thika Road. It is Kenya's premier psychiatric hospital and is the national psychiatric teaching and referral hospital. The institution admits patients with severe psychiatric disorder who cannot afford private services and are considered too disturbed to be managed in other public facilities or in the community. Its catchment area is largely the Nairobi urban area where the facility is located, together with the close rural and urban environs to the city. It has a capacity for 1,500 patients. It is a state corporation and a level 6 tertiary hospital. offering specialized neuropsychiatric services as well as research and training in mental health. Mathari Hospital was founded in the year 1910 by the colonial authorities of the British Kenya. It started as a smallpox isolation center. Later, it was redesigned and became the Nairobi Lunatic Asylum. The facilities were segregated with African patients who constituted 95% of the patients. Being kept in the worst condition, they lived in a very overcrowded bombers, which were the traditional form of housing in Kenya. It is worth noting that the facilities provided for Asians were somewhat better, with the best conditions being reserved for Europeans. Mr. Speaker, you realize that that is the time that the country was getting into the mood of a real colonization, and that is the time that segregation or Kenya experienced a form of apartheid in form of facilities that we have, that Africans were given some of the worst hospitals to be dealt with, and it being termed as a lunatic center is that they felt that despite the challenges that we were facing around that time, that Africans were still being treated in a monkey form of way. Up until independence, all psychiatric senior doctors and nurses employed at the hospital were European. The mission of Mathari National Referral and Training and Research is to provide evidence-based, preventive, curative, and rehabilitative mental health services. The facility training and conduct research with utmost professionalism through collaboration and partnership. The mission of Mathari National Referral and Training and Research is to be a global center of excellence in provision of healthcare services, training and research in mental health and neuroscience. The hospital mandate is to receive referrals of persons with mental disorders from other facilities for specialized care, receive mental ill offenders from courts, prisons, and police departments for assessment and forensics for mental health. Mr. Speaker, you realize most of the times in a court of law, when someone has committed a serious offense, the courts normally refer that person for psychiatric services to judge whether the person committed this heinous either acts under duress or for the purpose of entertainment. Provide treatment and rehabilitation for persons with addiction and behavioral disorders. The addictions here, Mr. Speaker, will be in form of drugs, will be in form of, for instance, 1 year, Mr. Speaker, this country has experienced so much drug intake from across the world. And whenever we were in that hospital, we were told that one of the major drugs that has been misused is heroin. And heroin has distorted the minds of young men, women, and even elderly people. And we were able to see not just people of a simple caliber, Mr. Speaker. We found there sons of great men within this republic, Mr. Speaker. We were able to find people who have been great doctors in Mathari Hospital. We have been able to see former government officers, very senior people, Mr. Speaker. We have been able to see people who have traveled across the world, and when they came back to this country, they could not sustain what they maybe went through in the other countries, and they are still held there, Mr. Speaker. Mr. Speaker, it is heartening when you are in that place. Provide training and research facilities in mental health. We found young doctors, some of them from Nakuru, being trained there. And Mr. Speaker, this is one of the state-of-art facilities that we have around that area. Participate as a national referral hospital in a national health policy planning. Protect patients from drug addiction and forensic offenders. In forensic offending, Mr. Speaker, we have the details of the fingerprints and everything from your brains and everything that is pertained in there, that the hospital can provide better ways of interacting with all these offenders. The interactions with the hospital board and management. The Speaker, in part of the session where our chairperson read us, we held a meeting with the entire board of Mathare Hospital, and they gave us so much inspiration on how they deal with patients. The committee held a roundtable meeting with the board management of the hospital for a plenary session where they interacted and discussed issues to do with mental health and its impact to the society at large. The challenge that they gave us in this board meeting, Mr. Speaker, is how at the county level we can have such a facility, and the facility can end up being of good use to the society. Mr. Speaker, it was a challenge because when you go to even most of our areas today, we have mental issues affecting this country. And it's affecting almost everybody, Mr. Speaker. The mental issues that we have within this country are so much that if we don't look or set up facilities within our hospitals, within our community, the society is at the breach of breaking or at the breaking point, Mr. Speaker. Members further visited the male and female wards. We found out that, Mr. Speaker, within Mathare Hospital, we had two sections, where we had male section and we had female section. And when we visited, for instance, Mr. Speaker, we were able to stay at the male section for a longer time. Our female counterpart were also able to visit and stay at the female section for a longer time. We found, Mr. Speaker, as I reiterate and say this, that the people who are there in that facility, Mathare Hospital, they are not just of simple caliber, Mr. Speaker. They are people spreading from all calibers. We have people who are very wealthy in that facility, Mr. Speaker. And you'll only be able to see how much mental health has damaged this country in such a facility, Mr. Speaker. Some of the people within our republic, Mr. Speaker, like last weekend, I lost a Form 2 student within my own area, Mr. Speaker, because of mental health. The person just woke up, a young girl just took her life, Mr. Speaker, because maybe they don't get access to such facilities on how to curb with the pressures that we have within this country. In the words, Mr. Speaker, the in charge shared the daily activities from morning to evening, and it included head count to ascertain the number of patients, Mr. Speaker. That each and every morning you must do head count, because most of these patients, Mr. Speaker, they are not able to contain the pressure that they have, and they can even escape. Some of them are professors, Mr. Speaker. Some of them are great doctors, Mr. Speaker. I was amazed when I saw some of the people that I know, Mr. Speaker. Some of them are TV reporters that air news within this republic, Mr. Speaker. And we were able to see some of them there. Patients take their shower. They are not washed, Mr. Speaker. They just take their showers so that they can also be trained to come back. They have their breakfast. And even before breakfast, Mr. Speaker, there's a point that I noted, that they make their own beds. And they are used, the making of the beds, Mr. Speaker, was used to assess whether this person is now coordinating with what is happening. Medication and counseling. We found very young people, the Gen Zs of doctors, Mr. Speaker, who are counseling these people from morning to evening, because most of them, maybe it's family issues that push them to the limit of where they are at the moment. Tea o'clock is normally at 10 a.m., and the size of the cups there, Mr. Speaker, is very big. So I found that very amazing. The counseling proceeds. They'll have lunch, and they have a very balanced diet in there. Medication and counseling. They have their own medication, then they are counseled. Patients taken through therapeutic sessions, Mr. Speaker. In the therapeutic sessions, Mr. Speaker, some of them I think the chairperson will go further on that, on the discussion, on what part of the therapeutic sessions that we had there, Mr. Speaker. Some of them entail drugs, some of them just physical, some of them electricity or electrical, Mr. Speaker. Indoor games, Mr. Speaker, and then we have supper or dinner, and you'll go to bed in that place, Mr. Speaker. And they go to bed, they cooperate, they love each other there. Provide treatment and rehabilitation for persons with addiction and behavioral disorders. Mr. Speaker, addiction, if you want to know the real effect of drug addiction, I'll prefer that people visit Mathari Hospital, Mr. Speaker. You'll realize things are not well. I'll have advised school-going children to go there, Mr. Speaker, but it not to be good for them at the juncture, Mr. Speaker, because most of the people who are there, they don't even know the use, some of them, they don't even know the use of clothing, Mr. Speaker. So it will be not good for young children to be there. But it is a total depiction of what is happening within the state of health, within some of the places that we visited. Provide training and research facilities in mental health. This facility will advocate for even the county government of Nakuru, or each and every county, to take their own interns, their young doctors in such a facility, so that we can have better ways of knowing how we provide good health for such people. Participate as a national referral hospital in a national health policy planning, protect patients from drug addiction and forensic offenders. Please, members, note on drug addiction, because this is one of the worst things that is happening there. We heard a story of a doctor who, instead of just working on patients, the doctor ended up using heroin. And at the moment, the doctor lost it all. The interaction with the hospital board and management, I think that one has been indicated there, Mr. Speaker. And Mr. Speaker, departments of the Mathari National and National Teaching and Referral Hospital. The hospital has a total of 9 departments. That helps it operate optimally. These departments are psychological and psychosocial management. I think members can go through that there. The drug rehabilitation and treatment unit, that will entail drug use. Radiology department, the hospital has recently been installed with a digital X-ray machine with a capacity to take full body picture. Administrative department, this department will track each and every patient that comes there, and they will classify at what level of mental illness you are at the state at the moment. Child and adolescent mental health. This is where you find that mental health is not just affecting the people past the age of 30. It is affecting even the youngest of the people. You'll get a child at the age of 10 affected. The child at the age of 15. Gen Zs at the age of 18 to 34. They are all affected in this. Global Psychiatric Services, they also runs an outpatient psychiatric department which runs 24 hours every day. Forensic department or forensic psychiatric services. Mathari National Training and Research Hospital runs 2 clinics per week, every Monday and Tuesday, where mental status assessment of raw offenders is carried out. Community psychiatric. Mathari National Training and Research Hospital has an active nursing psychiatric department which visits patients at home for those that need to be followed up later. You'll find that most of the well-to-do families visit or plan for their patients to be seen at home, Mr. Speaker. Electroconvulsive therapy, ECT. This treatment involves sending an electric current through your brain, Mr. Speaker. This causes a brief surge of electric activity within your brain, also known as seizure. The aim is to relieve severe symptoms of some mental health problems. Mr. Speaker, previously that one could have been termed as one of the worst things, but it works best there. And I used to hate it a long time, but I think it works very, very well. In addition to the above highlights, the department, by the department, the facility has an outpatient department which has the following areas: health records, consultation rooms, cash points, waiting bays, dental services, and antenatal clinics. The human resource establishment at the facility. The hospital has a lean staff established despite its role in managing mental health issues in the country. The management said they have a total of 200 nurses who take care of the patients. Other cadres include counselors, psychiatrists, psychologists, psychotherapists, social workers, community health pharmacists, and occupational therapists. The achievement of the facility over the years. The facility takes pride in the following achievements over the years. In December 2013, Mathare Hospital attained a significant milestone. It was officially gazetted as a national teaching and referral hospital. This recognition reinforced the hospital's status as a leading center for healthcare, education, and research in the region. It's not just Kenyans who are in this hospital. We found out people from other countries within that area or that facility. Continuing its growth and development, in August 2020, the hospital attained the status of a state corporation, further solidifying its positions as a key player in the field of mental health and behavioral medicine. The hospital has a running and has only automated outpatient department, OPD services, accounts, and in the process of automating inpatient services, as well as roll out enterprise resource planning, ERP, automation of services has led to a 40% increase in revenue. Mr. Speaker, I think as a health committee, we have time and again talked about automation of collection of cash at our hospitals. And if you cite very well that Mathare, which is operating with mad people or dealing with patients who have mental health issues, if they can do such a automation, and they say that very well, there will be increment of 40% within the revenue. I think if, as a county, we were to do it, Mr. Speaker, would go far. Creation of a child and adolescent ward, which is the first in the country. The hospital rehabilitated a 30-bed capacity child adolescent ward, the only one available in the country for inpatient care for mentally ill children and adolescents. The innovation of wards, Mr. Speaker. There are challenges that they have within the Mathare Hospital that will include service delivery, research and training, governance, hospital finances, health information data, health products and technologies, health workforce, infrastructure, Mr. Speaker. The recommendations that the committee obtained from this visit and within our report. Having toured the hospital, the committee made the following recommendations: that the county government of Nakuru Department of Health Services should visit the facility to borrow a brief on how to manage the county government of Nakuru Psychiatric Center, which is based in Gilgil constituency, Gilgil ward. Mr. Speaker, Mheshimiwa Deputy Majority Leader leads her people, and I feel that facility should be taken care of to such status. This will ease the burden of having our own patients within Nakuru County going all the way to Nairobi and Mathare Hospital. That the county government Department of Health Services should automate services in all departments, including the accounts departments, for accountability purposes. Mr. Speaker, we cannot overemphasize that. That the Nakuru Provincial General Hospital, PGH, should introduce the research center in the facility. That the Nakuru Provincial General Hospital, PGH, should benchmark with the parastatal hospital to go to county corporations, parastatal of the county, for benchmarking on ways to improve their services. Create forensic department for audit purposes of all health facilities. That the county government of Nakuru should adopt modern record management systems to effectively manage all the county records. That the county government of Nakuru should have drug psychiatric unit in Gilgil sub-county, similar to the one in Mathari Hospital, Mr. Speaker, sir. That the county government of Nakuru should employ more psychiatric professionals to work with the main hospital within the county. Mr. Speaker, on behalf of the Health Committee and the Chairperson Health, that's our report, and I wish to state it as so, Mr. Speaker. Thank you, Mr. Speaker, sir. So I wish to ask the Chairperson Health, Honorable Njuguna from Elbagon, to second.
Thank you, Mr. Speaker. Mr. Speaker, indeed, the psychiatric issues in the country have been neglected, not only in Nakuru, but also in the country as countrywide, and these issues are thorny. And Mr. Speaker, I come from the social science field, where as a sociologist I would say that whenever there is a change of anything, including the leadership in the country, people are prone to social issues, and psychiatric issues affect them a lot. Mr. Speaker, even these GNZ's issues that we are seeing, they are also because of the change of government and the change of leadership. And before they adapt, they are prone to other challenges and other forces that leads them to behave the way they are behaving currently. Therefore, this change of issues, Mr. Speaker, leads them, some of them, to go to the extremes. But the only place that they can be rehabilitated, is at the facility, or psychiatric facilities. But unfortunately, Mr. Speaker, we do not have psychiatric facilities that are supporting our people. And Mr. Speaker, by saying so, it doesn't mean that somebody must go to the extremes. Everybody here is prone to depressions. We are prone actually to stress, and there are many stress factors that makes our people to go to those extremes. Therefore, Mr. Speaker, for us to address that issue, we felt as a committee we needed to know what is happening at a national level so that we can cascade that down to our facility. And Mr. Speaker, I want to tell you that if you see what is happening at Mathare, well, they're not doing as we expected, but they're doing well than we are doing down here. Mr. Speaker, each and every ward, though it is not amplified because of stigma issues, each and every ward, we have more than 20 patients of psychiatric nature, but because of how we have stigmatized these issues of psychiatrics, we realize that patients even are not taken to the hospital. And Mr. Speaker, in the past, and those who came with this language of English, they said each and every market has what? As a mad person. But that is not a mad person, it's a patient that ought to be taken to the facility, but because it has been a norm to our society that we usually just take it lightly, that's why we are having those persons in the markets, and they are supposed to be offered or to be given proper care that they deserve. Therefore, Mr. Speaker, this facility, as you have seen where it has come from, how it was established, and even to the very day where it is located, there is still some stigma associated with that facility. But however, to do away with that stigma, they opened outpatient services for other medical fields. For instance, if a mother wants to go for clinic, postnatal, perinatal services, they usually go to that facility. If there are dental issues, other minor, even injuries and so on and so forth, they usually go to that facility because they have opened it for other patients so that they can interact with other patients of psychiatric nature so that to try to reduce the stigma that has been associated with that facility. Therefore, that facility is doing well. They are trying their level best, and they are doing all they can to make sure that actually they have accommodated as many patients as possible. Mr. Speaker, I would wish also to inform this House that we only have one psychiatric facility of such nature, one Lifaro, and that is that Mathare. We also have one in Mombasa, but they are not doing well as these ones. And therefore, Mr. Speaker, a need, therefore, for us to have a psychiatric facility in our county. And Mr. Speaker, we have one that used to be a wing of that main Madare facility, which is Gilgil here, and we also had another one in Nyeri. But this one of us here, Mr. Speaker, we inherited even the patients from this Madari, and even the management there was worried when we went there, and they really shared with us a lot of information as to how we should improve this Madari hospital that we have at Gilgil. Mr. Speaker, I would wish to emphasize that we really need to have that facility as our psychiatric facility that will in fact boost the support from other facilities so that it can be county follow for psychiatric matter. If you go to PGH here, where they usually conduct electroconvulsion therapies, Mr. Speaker, you'll wonder and you'll be mesmerized because it is overcrowded. And that is because we do not have room for expansion, even to conduct therapies to our patients. But if you go to the Madari in Gilgil, there is room for expansion. There is room actually for everything, Mr. Speaker, that we need. Mr. Speaker, I would wish that that recommendation we have given for that facility to be upgraded, let it be as such so that at least we can be able to aid and to support our patients. Mr. Speaker, on the issues of forensic unit, it's not for auditing, and that is a typo. If you look at that recommendation, you realize that it has been said, Madare Hospital has 2 units. It has civil, where patients who have voluntarily been taken to that facility are taken through the systems of rehabilitation until when they are taken back to the community. But there is also another diversion, whereby you realize there are patients that comes from the courts because of the crime that they conducted, when actually they were under the influence or under the depression and other status, Mr. Speaker, or rather when they were sick on these psychiatric matters. When they are taken there, they are actually, they have their own unit, whereby actually the probation officers and other government officers and also doctors, they interact to assess them so that they can report back through the office of the Attorney General, so that even the court can make determinations whether to proceed with prosecution or to rehabilitate first. Then somebody is taken through the system of rehabilitation, then he goes back to the courts. Mr. Speaker, we need to have such kind of facility here, whereby we are going to aid our population. Other than, Mr. Speaker, having now patients moving from Rusoi North, they are taken to Madare Hospital in Nairobi. That is time consuming. We really need to have such kind of unit at Madare Gilgil so that the issues of even of courts can be processed very fast and easily so that our patients can also enjoy those services that they are having there. Mr. Speaker, on the issues of rehabilitation center, you realize in Nakuru, we do not have such kind of rehabilitation center. Our people have been prone and they have been subjected to the private developers or private facilities, like one that we had here, Jomek. But if you go to our public facilities, we do not have such kind of facilitations, and which is actually, it is timely and it is needed, Mr. Speaker. There is demand for that kind of services. Not only will it increase the revenue for our facilities, but it will also assist our population that is highly affected. Mr. Speaker, each and every month in Elbagon, we usually lose one person because of RICA. And Mr. Speaker, even today, we are mourning one of the gentlemen, we call him Gatunguru. He has been actually so much into RICA, and just because they know the family could not have actually been able to afford those services into the public rehabilitation centers, that persons have succumbed. Therefore, Mr. Speaker, we are requesting that the Nakuru County government to consider starting a unit or department to deal with this drugs menace that is affecting our country and our county, so that we can be able actually to save many young people and many women, because even women today, they are drinking, Mr. Speaker. Therefore, Mr. Speaker, I wish to second this report and request the honorable members also to consider passing this report so that we can see the actualizations of what we have stated. Also, Mr. Speaker, about the research and training, remember, Mr. Speaker, we are saying that we have medical field and we have been funding the health department highly. But we do not have research units. We don't do our research, our own research. Mr. Speaker, I don't know what to say, but we need to be guided by the data. But we don't have even the way of doing things in our facilities, and therefore if PGH can manage such kind of things, we'll be actually in a better place, and we'll be having an authority even to questions, and even to direct even appropriations, part of it in this county and this county assembly. Mr. Speaker, I beg to support and also to second this report.
I therefore propose the question that this House adopts the report of the Committee on Health Services on the benchmarking visit held at the Mathare National Teaching and Referral Hospital in Nairobi, held between 30th August to 3rd September 2023 and laid on the table of the Assembly on Tuesday, 23rd July 2024 during the afternoon sitting. The motion is open for debate. Majority Leader, followed by Mheshimiwa for Shabab, and then Honorable Jeff.
Thank you, Mr. Speaker. As I actually rise to support this great report, allow me, sir, to also take this opportunity on behalf of the House to welcome the students who are coming from Kahuho Secondary School in Elementaita Ward. Thank you. Led by their teachers, Madam Frida, Mr. Sami Kinudia, and Mr. Karanja. Mr. Speaker, I'm made to understand these are debating students, and we just want to encourage them that them visiting the assembly is very good in terms of their motivation. That at some point in time, we were also students. Some of us were in those debating clubs. And by the grace of God, we are honorable members today. Take this as you go home as a challenge, that you may not despise the moments of your very small beginnings as students, even within the debate club. If you work hard, serve your people, serve the nation, maybe one day, with a lot of dedication and commitment, you would also end up where we are today as honorable members in this Republic of Kenya. So feel welcomed on behalf of your honorable member, Mr. Honorable Nene. Karibuni sana, and feel part of this assembly. Mr. Speaker, I want to go back to the debate on the report that has just been laid before this honorable House by the Health Committee. I was trying to look at it, Mr. Speaker, and I tried to see the objective of the debate. And the main objective also was to comprehend the matters of mental health. Comprehending, Mr. Speaker, ideally is we visited to try and understand the issues of health, mental health. You know, mental health is a bit mystified, Mr. Speaker. And in many cases, we fail to understand these cases or the people who are having mental health. In this case, we visited those who are in its extreme cases, those who are already diagnosed and have gone slightly deeper to the state of being admitted within the Mathare hospital, which the Health Committee ably visited. Of course, when you are there, Mr. Speaker, you will be able to understand and feel together with these people. Sometimes they become neglected within the community, and many a times, even people do not want to associate with those who have already gone to that extreme or that level where they can equally be admitted, Mr. Speaker. We have families who have cases, and sometimes these people are even hidden in their own homes because you would not want them to be seen in public. Sometimes you don't want to associate together with them, Mr. Speaker. As this Honorable House visited, it was ideally to demystify and know that each and every family can have such a patient. And it is good to understand and to help them in terms of finances, in terms of motivation, in terms of bringing them out and helping them to have a life. Because mental cases, once you have already gained, is not the end of the world and is not the end of life. We've had a lot of cases that can be rehabilitated and they are brought back to the mainstream of life, Mr. Speaker. Of course, the other objective was also to see the impact, and we really know the financial impact that such patients usually have. In terms of the medicine, the daily taking of medicine, Mr. Speaker, they are quite expensive. It drains the family resources. And it is a good wake-up call also that as a county government, and even as a government, to see how we can channel more finances so that we can relieve the families of the drugs that these people use. And also is a wake-up call, Mr. Speaker, to improve on the facilities that we have. The chair of the committee has ably talked about Gilgil. Even here in PGH, Mr. Speaker, we have a small part of a ward or a subsection or an extension of Mathare in the name of Ward 8. Mr. Speaker, when you visit the place, and I think one of these days you also visit, we would want to get what we have gotten in Mathare, the main hospital, and try to bring some of those good practices even to our, because sometimes you go there, you find this patient, and it's good to, because it really evokes some emotion when you see the way they behave, the way they are being handled, the way they receive their drugs, the way they are the medics try to bring them back to the mainstream, Mr. Speaker. So it's good to visit so that whenever we are doing our budgets, and whenever we think of medical facilities at large, we are able to agree as an assembly to add more fundings so that they don't miss their daily drugs that puts them completely off and incapacitate them so that they are not able to function, to reason, to walk, to support themselves on a daily basis. So this report, Mr. Speaker, has come in handy and at the right time so that we as members can be able to understand what these human beings go through together with their families. Because at that time, when a person is declared a Mathare case, belongs ideally to the family, and many people, as I have said, shy away from them. Mr. Speaker, there are many great recommendations that the committee has made. As an assembly, it will be honorable to let the policymakers again, just as we heard about yesterday, to take action. We want to utilize the level 8, the Ward 8 that we have here, to facilitate them, to continue engaging more health workers, especially the psychiatrists, to help those people. And also, we should also go back also and think, before somebody reaches that stage where you can be admitted, what can we do as an assembly? Are we able to come up with the centers that when we receive the normal stresses, which starts slowly by slowly, are we able to have a place where we can be able to go, be it before counseling or for early prevention, Mr. Speaker? Because the truth is, in health matters, prevention is always better than the real cure. And if we can identify, maybe even within the same PGH or even within Mathare that we have in Gilgil, centers that when we feel fatigued and when we start exhibiting symptoms of these young people, when you start seeing them having the symptoms, because they can easily be helped early enough before they reach the stage, those almost vegetative stage, where they have to be put on very heavy drugs so that their senses can be able to come back, Mr. Speaker. It's not easy. But I want to thank the committee once more, and again, congratulate the chair for being very active. I think among the committees that we have in this House, Health, Mr. Speaker, as a leader of this House, is a committee that is doing us proud and tremendously well, also because of the great efforts of the chair. So I want to thank the chair and the entire committee for bringing up and evoking such emotions, even within our own selves, so that we can be able to think, what can we be doing for these so-called people who are not, who are Madari cases? What can we do for them? How can we incorporate them in the community? How can we embrace them, even if they are not our family members? And what can we also be able to do so that we can be able to protect and be able to prevent? And finally, what can an assembly do in terms of budgeting to ensure that these people are well supported? I've heard in Nairobi, even the able people employs these psychiatrists to visit their own patients, even at home. Of course, because they will not want them to be subjected to what they go through in the Mathare hospital. What can we do also as Nakuru? Because that is something when you go to benchmark that we should be able to do. What can we do so that we can reach the status where some of these patients, instead of putting them and congesting them in level or in Ward 8 and even in Gilgil, they can also be made, we have enough people who can be visiting and helping them even at the comfort of their own homes and at the comfort of their own family as the family's support. Mr. Speaker, with those few remarks, I really wish to second this report and also request that this report again should be implemented, Mr. Speaker. Such good reports should be implemented, that they will not again be put on or to gather dusts in the shelves. They should be implemented because it's for the posterity of this great county of Nakuru. Mr. Speaker, I raise to support this report. Thank you.
Thank you, Mr. Speaker. Kwanza kabisa, Mr. Speaker, nataka kukaribisha wanafunzi kutoka Elementaita. Karibuni sana katika hii bunge. Na mjue pia sisi tulianzia hapo pale muko tukisoma primary, na Mwenyezi Mungu akatuwezesha tukafika hapa, lakini ilikuwa ila kwa kumuaminia Mwenyezi Mungu, kumheshimu wazazi wetu na kuheshimu wazazi wetu. Karibuni sana. Mr. Speaker, I rise to support this report by the Health Committee that has been doing a very good job in this House, Mr. Speaker. Because the Committee on Health has been bringing us a lot of reports, and this is one great report that, Mr. Speaker, as I was going through it, I realized that we need to start dealing with issues of mental health, Mr. Speaker, right from our wards, Mr. Speaker. Mr. Speaker, we have, like every ward has a dispensary, Mr. Speaker. So my take is, I wish that we could have psychiatrists in our dispensaries that would be dealing with these issues when they come up, Mr. Speaker, from our dispensary, so that wakisha kuja kwa dispensary pale wameangaliwa na wale daktari wetu pale kwa dispensary, then they can be able to be referred to the PGH, Mr. Speaker. If we use that route, Mr. Speaker, I believe we can be able to diagnose earlier enough patients that can recover early, and then they rejoin the community, Mr. Speaker. Secondly, Mr. Speaker, I've seen a recommendation that we should have a research area in the PGH, Mr. Speaker. Mr. Speaker, mimi nimestuka sana PGH yetu hapa ambayo ndio hospitali inaangaliwa na karibu kaunti 3 Mr. Speaker, na haina research center, Mr. Speaker. A research center is of essence to this community in Nakuru County, Mr. Speaker. And so I'd like to request also and to forward to support this report that the county government should come up with a research center situated at the PGH so that it can assist us in checking on the new types of diseases that are coming up and maybe treatment, Mr. Speaker. So, Mr. Speaker, as I see it, I support and second this report. Thank you, Mr. Speaker.
Thank you, Mr. Speaker, for allowing me having this chance. And I want to, first of all, thank the team, that is the Health Committee, for the good work they are doing, led by our chair. Thank you very much. And I think this is the team that has brought so many reports in this House, Mr. Speaker, since we started in 2022, Mr. Speaker. Yesterday, we had a report from the Kenyatta University referral, and today we have the report for the Mathari Referral Hospital, Mr. Speaker. This is a very important institution, being in mind, Mr. Speaker, that anybody can find himself or herself in this situation, Mr. Speaker. Mostly, Mr. Speaker, you may find that we as politicians, we may find ourselves in such a situation, in most cases, when we lose our position, Mr. Speaker. So we are the first members who are supposed to recommend that we have a psychiatric hospital which is nearby, and because we have one which is in Gilgil, Mr. Speaker, and we have seen the recommendations that have been done. My question is, how can we be able to implement this? We have already seen how Mathari has done, and Mr. Speaker, being in mind that we have so many young men who have been addicted in drugs, and they would like to have assistance in at least neutralizing the chemical that is in their body, Mr. Speaker. We need the Gilgil Hospital. The recommendation that we have done is that it should be funded, Mr. Speaker. We are the people who are passing the budget. This is a priority that is supposed to be given to this hospital, Mr. Speaker. I don't know how much that we have given to Gilgil Hospital, Mr. Speaker. This is the right time that we need to give enough personnel, enough funding to make sure that this Gilgil Hospital is working to the best. Mr. Speaker, I was one of the members who visited the Mathari Hospital, and the way they treat even the patients, the number of members that usually visit that hospital, the outpatient who visit that hospital, they are big in number, Mr. Speaker, and they are really being helped. I wish that we have our Gilgil Hospital help this county to make sure that our patients are well attended. But, Mr. Speaker, the only way that we are going to attain this is when we give Gilgil Hospital the priority in terms of funding. So, Mr. Speaker, I support this report, and I wish that we give proper funding to this hospital so that it can give our patients the right services. Thank you, Mr. Speaker.
The Deputy Majority Leader, I noted precedence. We had given him a chance, but take the floor. DML.
Thank you, Mr. Speaker. Kwanza nataka kuchukua fursa hii kuwakaribisha wanafunzi na walimu ambao wako kwenye gallery katika ukumbi huu wetu. Na pia niseme ya kwamba mimi ni mkaaji ama mwenyeji wa Elementaita, pia huko ndio nyumbani, kijiji cha Kahuruko. So karibuni na tuwe pamoja. Nataka kuchangia kwa huu mjadala kwa kusema ya kwamba naunga mkono hii kamati na kuwashukuru sana kupitia kwako Bwana Speaker, kwa sababu ya mwenyekiti na kamati vile walitembelea pale hospitali ya Mathari na kufanya huu uchunguzi ambao pia utaweza kusaidia sisi kama watu wa Gilgil constituency ama hata county kwa jumla, kwa maana hii hospitali ambayo iko Gilgil ni hospitali ambao ni mtoto wa Mathari Hospital ile ya Nakuru ya Nairobi. Kwa hivyo yale mapendekezo ambao wameyatoa ni mapendekezo ya muhimu na pia ninayaunga mkono, na kuomba ya kwamba hii kamati vile vile iweze kutembelea Gilgil Mathari Hospital ili pia waweze kuangalia mambo ambayo na changamoto ambazo ziko mahali pale, ambazo nimeona pia zingine zinalingana na hii Mathari Hospital. Hii Mathari Hospital ya Gilgil kuna vile imekuwa changamoto kwa sisi watu wa Gilgil, kwa maana huwa tunabebeshwa huo mzigo. Sub-county hospital ya Gilgil inabeba mzigo wa pia Mathari department, ambao zile pesa ambazo huwa zinakusanywa kwa kila siku ama matumizi ya hospitali pia yanatumika pale katika Mathari Hospital. Unapata tuko na changamoto ya madawa, tuko na changamoto ya facilities, tuko na changamoto ya wafanyikazi, kwa sababu hizi pesa ambazo zinaokotwa katika hospitali yetu kila siku inabidi pia zigawiwe pale Mathari. Kwa hivyo ningealika hii kamati ikuje na iweze kutoa mapendekezo kwamba hospitali yetu ya Mathari Gilgil iweze kushikiliwa na county na iweze kufanyiwa mchango pia kwa wafanyikazi na madawa na mambo mengine na facility. Kuna vile nilikuwa naona Bwana Speaker ya kwamba hii hospitali kwa sababu imekuwa mzigo kwetu, tungeomba hata kama ni kuje kwa facility ya PGH ipate nafasi hapa, ijengwe county Mathari Hospital. Kwa sababu vile imekaa kule Gilgil inabebeshwa mzigo watu wa Gilgil, lakini kikuja hapa county watu wote ama the whole county itashikilia huo mzigo. Kwa hivyo kama wataonelea ni vyema bado ibaki mahali pale, pia kazi zake zote ama expenses zake zote zishikiliwe na county, sababu unaona mpaka pesa zangu za ward saa zingine na surutishwa kuziweka katika hiyo hospitali, na unaona zile pesa tunapata kwa ward ni kidogo sana. Kwa hivyo nimeunga mkono huu mjadala na kusema ya kwamba tumekaribishwa health committee katika Mathari Hospital ya Gilgil ili pia tuweze kusaidiana mawazo ya kuweza kuinua hiyo facility. Asante Bwana Speaker.
Honorable Amaitha, and then Honorable Mutai.
Thank you so much, Mr. Speaker, for giving me this opportunity to stand up and support the debate. Before I do that, I want to welcome the students. Welcome to Nakuru County Assembly. This is where great ideas happen, and this is where we change the lives of the people of Nakuru County. Mr. Speaker, sir, as I go to the debate, I want to thank the Committee on Health. Thank you for such a timely report that is actually affecting all Kenyans at the moment. So I stand to support the motion. Mr. Speaker, I do not want to reiterate the statistics that we have in the country because it's at a dire need. But I want to come up to suggest a program that the national government as well as the county government can implement on the short term before we can get all the finances and the funding for the hospitals in various cities and counties. Mr. Speaker, sir, I want to bring a proposal to the floor of the House to the national government to come up with a compulsory program for all Kenyans. What do I mean by compulsory, Mr. Speaker, sir? Is that every Kenyan needs to undergo a minimum hours of counseling with a government counselor. What I mean, Mr. Speaker, is for Kenyans to access any government services, they need to have undergone, like, for instance, 50 hours of counseling that is going to be updated, automatically updated on the e-citizen. I want to give an example, Mr. Speaker, sir. The reason why I'm saying a compulsory counselor is because a counselor mitigates the effects of mental issues before we can go to a psychiatrist. And, Mr. Speaker, it is, according to the Constitution, Article 43, 1A, it states that every Kenyan is entitled to the highest attainable health services. That it includes the mental health services, Mr. Speaker, sir. Therefore, it's the duty of the government to ensure that all its citizens. The same way we ensure that children below 5 years are vaccinated, and it's actually a crime not to vaccinate your child below 5 years, it should also be a crime for a Kenyan not attending a minimum hours of counseling. Mr. Speaker, sir, these minimum hours of counseling, it doesn't mean that someone is mentally ill. It means that we are prioritizing our mental health so that we can reduce the stigma that comes with approaching a counselor or a psychiatrist. Mr. Speaker, sir, if we start the mandatory counseling services all the way from lower primary, we have 70 hours for lower primary, we have 60 hours. They are going to the university, Mr. Speaker, we would have identified if there are any issues of any mental issues with our children. We should have addressed the issues of those children who feel that they cannot talk to their parents, they cannot talk to their teachers. It's going to be a very important initiative, such that if a student has not attained the minimum hours of the counseling, they should not get their certificates, their school living certificates. We need to make sure it's a must for Kenyans to be healthy, a must for Kenyans to be mentally healthy, so that we can have a mentally working, a healthy nation. It's not only about TB, eradicating TB. We're not only talking about eradicating malaria. We're also talking about eradicating mental issues, of which it's a valid issue for every single Kenyan. Therefore, Mr. Speaker, sir, I suggest we come up with the initiative where we can also empower our CHPs. Our CHPs can have the certification of the counseling, whereby when they are going to the villages, they have the services over there. You're not going to get someone. It's a very encourage a lot of counseling, also the government, SHIF. Thank you, Mr. Speaker, sir. I'm looking forward to a nation where we are going to be, as we are eradicating the TBs, we are going to eradicate the mental issues that are creeping up with our young people and also our mothers and fathers back at home. Thank you, Mr. Speaker.
Thank you very much, Mr. Speaker, sir. Let me take this opportunity also to join my colleagues to welcome the students from Elementaita that feel welcome. And as a teacher by profession, I just want to make one encouragement to them that you students, decision really determines your destiny. And the decision that you make now will go a long way in shaping your future. That very small and very humble platform that you get in your schools in debate club really can shape you to the future leadership. And you will be presenting issues concerning the environments that you come from, and you'll be representing people in various endeavors. So keep on keeping on and put a lot of effort to that effect. Mr. Speaker, sir, allow me also to give my views on this report, that it's a very good report, and I'm very sure that we are really getting a lot of information, and this information will go a long way in assisting us to improve the facilities that we have in our county, and also to give more recommendations. Mr. Speaker, sir, I've also made a visit to ward number 8 in our professional general hospital, and I realized that, one, there is a lot of congestion, and there are a lot of challenges within that area. And I saw the categories of departments that are in this report. And indeed, they are quite encouraging and shows that some good work is taking place there. But when you go to Ward 8, people with different psychiatric issues are actually grouped together. And this may further go even it may cause some further stress to the person who was not badly off when mixed with people who are at the extremes. So I want to believe that going forward, something can be done on the same. And moreover, Mr. Speaker, sir, I believe that if a team of officers in charge of psychiatric issues can be posted to each and every sub-county, I think the better. As for now, as you are quite aware, our country could be undergoing a lot of economic challenges. There are a lot of stresses that trickle down into the villages. And some of these things may not even require drugs. It requires a bit of counseling. I want to believe that if our good government can really take a step of having some officers to provide some counseling sessions, it's going to help a great deal. Otherwise, I stand to support the good work that this Committee on Health is doing. Thank you.
Honorable Francis Kuria and then Honorable Jane.
Thank you, Honorable Speaker. I'm Francis Kuria from Malawa West Ward. First of all, I would like to also welcome the students from Kauho Secondary School. They feel much at home. This is a house of rules and order, where we make rules, we pass bills, matters to do with budget, and it's also good you keep inspiring to be in this house, because it will make you have a bright and bright future. Honorable Speaker, I stand to support this report. I was thinking of this report, and mostly, Honorable Speaker, when you talk of Madari Hospital, what usually comes in mind of many is something to do with it's a Madari Hospital. It sounds like it's a facility where we have criminals. But once we visited this facility, Honorable Speaker, we find there are many causes from the patients who are there. There are many causes that make them to be there. One, it's not about drug abuse, Honorable Speaker. We found depression is real, and we found most of our parents most of the patients who are in that facility are our parents. And when you try to look at the history, what makes them to be there, we find when we visited the female ward, you find we have women. And when you do a research, maybe a woman was giving birth maybe to a twin, and then something triggers to the brain, and she suffered from depression, which caused that patient to be there. So it automatically reflects to our minds that it's not a must that you must have undergone maybe, or you have taken drugs so that you can be a patient in that facility. Honorable Speaker, it's good for even our students here to note that drug abuse have become the major cause of most patients still who are there. You find some use drugs maybe by inhaling, injecting into the nerves, Honorable Speaker. And maybe someone is doing that without knowing that it will cause a natural harm within, or it will create a natural damage within your body. And some of those drugs, Honorable Speaker, they are very harmful because they will damage even the brain, the blood. Honorable Speaker, we have to have a way, and that visit makes us to have a way on how we are going to prevent such causes to our, and mostly our students, Honorable Speaker. It's very good that they visited this house and they find this debate, because you find most of our day school, Honorable Speaker, and I start to be guided, I'm not out of this report, but it's good they have this information, Honorable Speaker, that most of our students are doing things without knowing what will be the cause in future. So it's good they find this debate on the floor of the House, Honorable Speaker, so that even when they go away out of this House, they will know that despite what someone is doing without being notified, there is a natural harm that they cause within their body. Honorable Speaker, that facility, when we compare it with a facility at Gilgil, we need to improve our facility there, and I support what Honorable Rose have said here. We visited that facility, Honorable Speaker, and I would like to urge we come to a row. If you compare most of our prisons, I talk of Naivasha Maximum Prison there, we take criminals there, Honorable Speaker. Is there a way we can come with a row that we make those facilities free? Why? Because we need to change lives of our electorates here within the nation. And these facilities, they are a bit expensive, Honorable Speaker. If you look some of the challenges that we find there, you find they are undergoing lack of enough funds, Honorable Speaker. So if there is a way, because the medicines that are used to cater for those patients, they are a bit expensive, Honorable Speaker. So if there is a way, we can come into a conclusion that the patients that visit these facilities, they will be attended free of charge. It will be of good help to our residents, Honorable Speaker. I therefore raise to support this report. Thank you.
For this opportunity to contribute to this very informative and very relevant motion on particular issues that our team, and first of all, may I welcome the students that within this assembly for the opportunity maybe to be here and also know how we govern ourselves, because they are part of this government. Very soon I can see they are even very proactive. We are calling them the Gen Zs. And therefore we know that when they are here, they have an opportunity to learn on matters governance. The report that has been tabled, I stand to highly support, and also comment on some few issues that require maybe Madari Hospital, which is very good. You'll realize that in our localities, in our wards, especially may I mention my ward, we have a lot of problems on matters depression, bipolar disorders, and even mental maybe problems because of the nature maybe of our economy. And therefore, most of the times you are dealing with patients whereby you have to look for injections. There is a particular injection that we give these patients. I've been in support of like 7 of them, whereby they take an injection monthly of 1,500, and this injection is usually provided in our health centers. I'm standing to say that this is a very, very good idea of making sure that we have services of mental problems given in our areas, and especially trickling down to our wards. You find that if the health committee can raise this maybe policy whereby they will give us drugs, as they distribute these drugs to our local health services, they include free service of this particular drug. I'm not very good in medicine so that I can tell maybe the particular type of drug, but I know it is there, and when we give 1,500, we are able to receive that injection. I'm requesting, because of the there are many number of people that we are now being treating. Like now in my area, in the 3 locations, I'm having like 7 patients. And you find that when you don't provide them with this injection, they become very wild, and they usually give their parents a lot of pressure, because everybody will think that these are madmen, and you know how much it is not actually very much appreciated in the community. So we find that we keep running up and down looking for the money so that we can keep injecting these patients. So as much as we are having this recommendation, and as much as we are visiting other institutions, I think we should also make an effort of, if this report would have gone hand in hand with the situation at Gilgil, because I have also been taking patients to Gilgil, and it seems like it is the only facility we have. You look at this report, Chairman, I can see it's like it was done last year. But now, we are almost heading to the past mid of this year. It seems we also need to be proactive and very fast in reporting these things so that we can be able to incorporate them in our budget and in our operations as an assembly, even if it is making policies, the health committee to act fast so that we are able to get this information. Even if we don't happen to visit these areas, most of us are very, very familiar with what we are talking about, and therefore we are looking forward. We are really, really looking forward and appreciating that the health committee will take a step further and make sure that even in our ward level, these services of psychiatric, and even if we don't have enough psychiatric, because we might also not have enough numbers to be provided in every ward, the nurses that are already in existence should be given something like seminars, or maybe be taught somehow how to deal with these cases, as even we pledge to any motion that requires our support, and especially in providing this very, very, very essential service to our people. So thank you so much, the committee, for the work that you've done, and we believe that this report will not just be another report, it will be a report that will be acted upon, and will be able to be maybe within 1 year to see even these activities trickling down and being reflected in our particular wards. Thank you very much, you honorable speaker, sir.
Mover to respond.
Thank you, Mr. Speaker. Mr. Speaker, indeed it's true. Due to stigma and other issues as stated there before, there are issues that we really need actually to dwell on, and there are issues that we need actually to give a lot of emphasis on. Mr. Speaker, I want to appreciate the comments that has been given, or rather that have been put forth by the members, especially on the issues of capacitating our members of the public, by emphasizing to them to actually to be enrolled into the SHIF, that is a social health insurance for the country, so that actually when they go to the facility or to hospitals, they'll be free. There'll be free services that will be rendered to them. Mr. Speaker, it's also good to emphasize to the members from their various wards to put aside some funds to go directly to this venture of SHIF, so that when those people who have these challenges in their wards, they can be able to be covered through the ward kitty, and so that when they go to the facilities, they are going actually to enjoy free services, and they are going to be supported. Also, Mr. Speaker, I would wish also to emphasize on the issues of the CHPs being taken through some trainings, so that they can even start actually having alcoholic anonymous groups and other groups, supportive groups in the wards level, so that they can be able to support those who are being affected, for instance, by alcohol, those who have actually depressions. When they go to the groups, therapeutic groups, they can be able actually to, to release and to relieve themselves, rather than allowing them actually, or giving them a lot of time to escalate to those levels of extremes levels, whereby they actually be ending up to the psychiatric attention. Mr. Speaker, also on the issues of the Gilgil facility, we cannot actually wish to bring it down to the PGH because there is no room for expansion, as I said. And psychiatric issues, to some extent, they require a bigger area so that actually when they'll be going for therapies, for instance, there is some, according to the levels of engagement, there are those patients that requires actually to be exercising. If you look at PGH, I don't know where we are going to get that field, whereby even they can have football as a part of their games, volleyball. I don't believe that we have any space that is remaining here. However, Mr. Speaker, as the attention have been put by the report as far as the Girigiri facility is concerned, I believe that the department is going to carry on with to implement, or rather to implement those recommendations that we have been given. And I believe when they will implement those recommendations, that is going to be our best facility as far as psychiatric matters are concerned. Mr. Speaker, also on the issues of the dispensary has been mentioned from various wards that we come from, and how I wish that youth-friendly centers that we recommended, and we have already passed some laws requiring that each and every dispensary and health center to have youth-friendly centers, whereby we can have counselors or other psychology staffs who can actually be hired even under the internship. And Mr. Speaker, remember that we have many students who are out there, but they are not doing anything. They are not practicing the course that they studied. Therefore, if we can open internship programs whereby we can be able to post psychologists to these facilities that we have under the youth-friendly umbrella, I believe majority of the members of the citizens, they will be finding them at those actual levels, and they are going actually to address a lot of issues, because prevention is better than curing. But in Africa, we are using that monkey theory of curing rather than preventing. Therefore, I believe if we are going actually to embrace them and embrace the youth-friendly center, things are going actually to move into the right direction, and we are going to save our population. Mr. Speaker, the average number of members of the public that are facing hardship and they are having issues to do with psychological issues or psychiatric issues are more than we are expecting. And I can tell you, 50% of the members of the public are dealing with depressions and other issues. And therefore, if we are not going actually to save them by providing infrastructure and human resource support, I tell you, Mr. Speaker, we are going to have a breakdown in the social arena, whereby you're going to find that actually majority of our people are not going to be normal. And Mr. Speaker, I want to end by saying, every person is mad, but the degree of madness varies. Therefore, that variance is one that is alarming, and I want to tell you, we need also to assess ourselves, because to some extent, as members have said, the way people are behaving, the way people are actually, they are, to some extent, they are erupting in terms of behavior. I tell you, we really need to do something, and we really need actually to save and to salvage the situations and put enough mechanisms as far as the mental health is concerned. And we need also to eliminate the stigma that has always been associated with these mental health issues. And by so doing, I believe things are going to change. Mr. Speaker, I want to request these members to pass this report and also make sure that as a House, we are going to make some follow-ups as far as the implementation of the said report is concerned, so that we can save the members of the public from the vagaries that they have been going through as far as mental health is concerned. I beg to end and to request the members to support this report or to pass this report, so that after 6 months, I'll be back here with another report, because we are no longer going to the facilities after 6 months. We'll be going to the field to interact with the members of the public, so that they can also give us feedback as far as the implementations of the recommendation that we put forth is concerned. Therefore, Mr. Speaker, I beg to request the members to pass this report. Thank you.
I now put the question that this House adopts the report of the Committee on Health Services on the benchmarking visit held at the Mathari National Teaching and Referral Hospital in Nairobi, held between 30th August and 3rd September 2023, laid on the table of the Assembly on Tuesday, 23rd July 2024. during the afternoon session. As many as of the opinion say aye. As many as of a contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of the morning session.
This House stands adjourned until 2:30 in the afternoon.